In your health headlines, it's been used for medical purposes for years now in California, but now voters have approved marijuana for recreational use, and it raises the question over how to manage its use safely. Dr. Mitchell Goldman from UCSD is here now with some of the health benefits and the things users should look out for. Dr. G, good to see you.
Good to be here, Kathleen.
Is there any real way of knowing how many people currently use marijuana and how big of an increase, if any, we could see now?
Well, a lot of people use it and a lot of people voted for the use of it. And what we've learned is over the last few years, interestingly, the use of marijuana has gone up in adults over the age of 26 and has actually decreased in adults less than 18. And that's a really good thing, because the biggest problem with marijuana use is that we really don't know how it interacts with teenagers. And teenagers are the people that their brains are growing and they're developing a lot of skills. And the biggest problem with marijuana is it affects the frontal lobe of the brain, which is responsible for a lot of the skills that teenagers are developing.
And there are some real conditions that marijuana is used to treat. Can you speak to some of those?
There are a number of conditions that have been shown that marijuana and the cannabinoids, which are a type of receptor marijuana interacts with, actually can cause some good, and they're listed over here. Of course, anorexia in people with HIV/AIDS, it's one of the best things for them, but it can also be used in people with anxiety disorders and psychosis, glaucoma, Parkinson's, seizures, and a whole host of other diseases. Now, the biggest problem is because marijuana was so severely regulated for so many years, there haven't been enough medical studies to really show what is really working and what doesn't work. And so one of the best things that could happen with this more legalization of use is that there's going to be more funds so that doctors can study the use of marijuana and the effects of marijuana on the brain much more clearly.
And that's interesting because it sounds like this is somewhat uncharted territory for physicians as well. So how can they help their patients manage their use of marijuana properly and safely?
Yes, well, that's a great question. One of the biggest problems that we have is that you don't know how much THC, or the active ingredient, is present in the marijuana these days. You know, people have estimated that there's 40 times more THC in marijuana today than when I was growing up as a teenager in the 70s. And so it's not the same pot that we have today that we had before. And so the most important thing is to try to regulate it, just like alcohol. It's like you want to make sure that your teenagers, people under the age of 21, don't use it because it can affect the brain. And if you're using marijuana recreationally or medicinally, you don't want to operate a car or heavy machinery. You don't want to take it with alcohol or other drugs because it can interact and prove very disastrous in those situations. But the biggest advance that's going to come is there's going to be more studies to show exactly what marijuana is really good for and what it really isn't good for. For one, studies that have been going on in Israel, of all places, is marijuana has been shown to be good for concussions and people with traumatic brain injury. And so these are just a few of the additional areas we're going to find a use for the cannabinoids or chemicals that are present in marijuana.
All right, somewhat of a new frontier. Here we go. Dr. G, thank you.
It's good to be here.